Hello. Thanks for joining us for another Fiery Service interview. Our guest today is Dr. Rachel Hall. Rachel lives and works in Kenmore, a suburb of Brisbane here in Australia. Dr. Hall is a dentist and her business is called Evolve Dental Healing. You may not have had an appointment with Rachel as a dentist if you don't live in southeast Queensland or northern New South Wales. But if you use the internet or social media, you may still have met her or certainly come across one of her many postings. She writes frequently on her own blogs, contributes more than occasionally on other people's blogs, makes comments and posts to Facebook, Twitter, participates in LinkedIn, and contributes recipes, to name just a few that I'm aware of. I've also seen recently that she's intending to get into podcasts and maybe even video blogs. We'll learn more from her today. Welcome, Rachel.
Hello, Gayle. How are you?
I'm good, and thanks for coming over on very wet roads this morning.
My pleasure.
I'm always interested in why people choose a particular career path, particularly ones that involve years of education and substantial financial outlay. So what made you decide to undertake this particular career, and when did that come about? When did you know you wanted to be a dentist?
Well, I've always had a love and a passion for science. I'm really intrigued by the workings of the human body and what goes on, and I really care about people. So I knew I always wanted to do something medical, but wasn't quite sure what. And then one day, I'd been doing a little bit of reading as a child. I'd have been about 13, I think, at the time, and I just knew dentistry was for me. It's an absolute passion, and nothing was going to change my mind.
Wow. So as soon as you finished your general education, did you go straight into medical school?
Straight into dental school, 5.5 years of study, and then once I graduated, out into the big world.
And where was all that? I take it from your accent. That may not have been here in Australia.
No, I'm from Birmingham in the UK originally. I did my training in Leeds in Yorkshire, and I spent about 8 years working after I'd graduated in Leeds.
And what brought you to Australia?
Better weather, more relaxed lifestyle, change of scene. But there was almost a calling in that as well. It's like I'd been over here on holidays, and I just knew Brisbane was home.
Oh, so you went straight to Brisbane when
you
got here?
Yeah.
And did you use your career as a pathway into Australia?
That's correct. I got a visa, absolutely no problem with being a qualified dentist.
And so you went straight to work as soon as you got to Australia?
I actually had a rural sponsorship in Rockhampton in central Queensland. Spent nearly a year there and then transferred to Brisbane.
And started your own practice?
No, I worked in a amalgam-free holistic practice for almost 4 years.
Oh, yes.
And that's where my love of holistic dentistry blossomed. And that practice changed hands, and it was very apparent that it wasn't going to have the same ethos. So I worked for somebody else, and it showed me what I didn't want to be as a dentist. There was no love of the patient. It was all about getting the job done and getting the pay packet. And I was very close to quitting dentistry at that point. I was at a big low, and I felt there was two choices: to follow a different career path or to go it alone and set up my own business. So I took the gamble.
And it is a big decision.
A very big decision.
Now, just for the sake of clarification on the interview, I want to let you know that I've had a lot of experience in a dental chair.
Oh, good. So we've got something in common.
We
then.
do. I know what I'm talking about as far as the patient's view goes. Now, I occasionally meet someone, however, who says they've never had a cavity or a filling, and that's like a parallel universe to me. It's like, is that really possible? I'm wondering, do you see very many people of an adult age who don't have dental work?
There's a small percentage. Most people would commonly have a handful of fillings. I mean, pretty much anyone over 50, unfortunately, seems to have a mouthful. But I suspect that was the style of dentistry back then, that if there was anything that looked like it might need attention, it was get the drill out, make a big hole and fill it just in case.
Right. Okay, so that's what happened to my generation.
You were the guinea pigs for the profession.
So we can probably assume that most listeners will have had a filling at least, even if they haven't had a tooth
Correct.
extraction or a root canal or a crown or gum disease, all of which are very unpleasant. So do you find most patients are fairly anxious when they come to you?
A large percentage are nervous, and then there's another percentage that would be upper level from that, where they have a degree of anxiety. And then we also get phobics who, even for them to just pick up the phone and say hello to somebody at a dental practice is a huge, huge thing. I find I probably get more than my fair share of anxious patients, or it seems that way, but we just take our time with them. We explain everything we're going to do. We give them a chance to ask questions. We explain and show them what we're doing and why we're doing it. Let them have a break when they need it, and just allow them to feel cared for and nurtured while they're in the chair, which is a very different experience, I would imagine, to most dental practices.
Mm-hmm. And do you find you need to allocate extra time in your appointments in order to give that level of service?
Absolutely. And I think it's very important that people are allowed to feel at ease and not feel rushed and pressured. They are very, very vulnerable when they're in the dental chair. I mean, after all, you're lying back, you've got your mouth wide open, there's all these people leaning over you with masks and glasses on and strange equipment coming your way, and you've got to just trust that it's going to be okay.
Yes, it's a big experience going to the dentist.
Yeah, it's huge.
And you work on all ages, children included?
All ages, children included, but mainly adults.
And which do you think is easier?
Sometimes the children are easier than the adults, because I think as adults we've already developed a preconceived notion of, I'm going to have a bad experience because I've had one before, and that takes a long time to break down.
True. Well, we won't spend the whole interview on specific dental issues, because I'm also keen to talk to you about your current internet activity, but I do want to use this opportunity to learn from your years of experience. And I see from your website, which, by the way, listeners, is evolvedental.com.au. So you can, she's got a great website, lots of information on there, but for those listeners who may not be inclined to spend more time on the computer than they already do, we've got the luxury of hearing from Rachel directly this morning. Now, we've mentioned amalgam, and this is a big one, so I want to start there. It says on your website that you're an amalgam-free and mercury-free dental practice. So tell us what that means and why you've chosen to make this part of your service.
Sure. Dental amalgam is a mixture of metals. Essentially, it's 50% mercury. Now, as dentists, we've been trained that once you've mixed it all together, that is perfectly safe to put in someone's mouth. However, once we've drilled it out, it's now toxic waste material. So for me, there was always this
bit of a contradiction.
Yeah, it's like, well, how can it be safe in one place and yet it's not safe in another? What happens is when people have amalgam in their teeth, it's constantly leaching mercury vapor from the surface. That gets inhaled, goes into the patient's bloodstream, and then goes off to various tissues and organs. Mercury is one of the most toxic heavy metals known to mankind. It damages our nerve cells, kidney cells, liver function, affects hearts, nervous system, immune health. It actually can create an absolute travesty of illness in the body, yet dentists are trained it's okay. We as the dental profession are spending hour after hour drilling out fillings, breathing in mercury and putting our own health in jeopardy. So once I realised that this went on and that there was a different way of doing it, there was no way I could go back to putting something I knew was toxic into somebody's body. There was also a level of care that needed to be taken then to make sure that when we handled the amalgams, when we were drilling them out of somebody's mouth, that we weren't all breathing in the mercury vapor and the patient wasn't swallowing the bits of filling material. To take that further, when you drill out amalgam, it all gets washed up the suction line and goes straight into the water supply.
Great.
So you're then polluting the environment. And there is enough mercury in one little filling to pollute a lake that's quite a big size, where they'd say, no, you can't fish in there anymore. So what we've done at our practice is we don't use amalgam. We're very safe when we drill it out to ensure that we look after everybody's health. And we have a device on our suction line that captures the amalgam waste, so it's not going into the water supply.
Excellent. So when did this new option become available? Do you know? How many years ago?
Well, I think holistic dentistry was very much in its infancy when I first graduated about 20 years ago, but it's not something I'd ever heard of in the UK. And then after moving to Australia, I somehow ended up working in an amalgam-free practice where they were very big on the patient's health and well-being. And at first I was slightly sceptical, as you would be, having been trained that this stuff's great. But I saw changes in the health of my patients that I couldn't explain. I saw changes in my own health and well-being that I couldn't explain. Because by the time I was 30, I'd gone from being very vibrant, energetic, well-balanced human being to being fatigued, irritable. I'd get coughs and colds really easily. I would be stressed, hormonal, all sorts of things that I just put down to working really hard and playing really hard back then. And if I'd have actually sat down and filled out a mercury toxicity questionnaire, I'd have probably ticked all the boxes. And as I wasn't exposing myself to mercury, my own health improved.
Right. So just for people who may not know what those symptoms are of mercury poisoning, could you just give us a couple of examples?
Well, some of the most common ones are irritability, mood swings, insomnia, fatigue in particular. One of the others is what they call brain fog. So you can't follow a thought through and you just lose track all the time. Weakened immune system, upset stomachs. The list goes on and on and on and on, really. And that's why it's so hard to pick. And doctors aren't trained to look for environmental toxins when someone comes in and says, "Hey, doctor, I'm feeling a bit tired at the moment."
Yes, well, I know those symptoms because I had them, and I did about 8 years ago have all my amalgam removed.
Good for you.
Yeah, I had a big noticeable improvement in my health as well. So I feel it's really important that people know, and especially older people, like you say, over 50, because some of that amalgam's been in our mouth a long time. And so it's deteriorating now. And it can take 30 years for symptoms to start to show. I mean, if you've had an acute exposure to mercury as a child, as a young child, you're going to have developmental abnormalities and lots of problems that they can track back. But when you're being chronically drip-fed mercury every day, you're not going to maybe put two and two together that the decline in your health is from the fillings that you have in your teeth. I mean, patients with things like dementia and Alzheimer's, MS, for example, some of them can be tracked back to mercury toxicity. Well, it is very important, and I was lucky. How I found out was my daughter was at a party and talking to a dentist who had recently written some articles on mercury poisoning.
Wow.
And she was listening to what he was saying, and she's thinking, Mom's got all those symptoms. And so she's the one who said to me, "Gee, you should look into this." So hopefully anyone who might be having those symptoms and listening today will have a think about amalgam removal.
On that note, though, please don't just rush out and get any dentist to remove your fillings.
Yeah, because it's got to be done right,
obviously. It's got to be done right, and they've got to have an understanding of the dangers of mercury, and they've also got to have an understanding of how to support you as a patient through the process. It's not just drilling the fillings out. There's much more to it.
And do you think it would always be recommended to have amalgam removed, or some instances not?
Look, I'm going to be slightly biased, and I'm going to say I believe strongly that nobody should have amalgam in their teeth.
Right. Okay. Well, let's move on to fluoride.
Absolutely.
Another controversial subject,
perhaps.
Yes,
and very much in the news at the moment in Australia.
Yeah. Now, this is, again, something that affects almost everyone because it's hard to find a water supply that does not contain fluoride. What are the advantages and disadvantages of having fluoride in your water system? Okay,
well, the supposed advantages are that by drinking fluoride in our water supply, it strengthens our tooth enamel.
Okay.
Well, my understanding is that only applies while the teeth are actually growing. So that's up till about the age of 6. Once you're over 6 years old, all your enamel on your adult teeth, apart from your wisdom teeth, I believe, has already formed. So ingesting it means it's not going to your teeth, it's actually going to your bones. There is no scientific evidence, as far as I have found, that categorically states fluoride makes your teeth stronger. So the disadvantages are the fluoride that's put in our water supply is actually a waste product from industry. It's not a pure fluoride, it's full of contaminants. It's actually a poison from what they're saying. It causes damage to your brain function. It calcifies the pituitary gland, which is the gland in your brain that controls all your hormone output. It weakens bones by sucking calcium out and actually making them brittle. And it can actually harm the teeth. By having fluoride in too high a concentration, we see things called fluorosis, which is pitting and weakness of the enamel on the adult teeth, which can actually be very disfiguring and unsightly and make the teeth more prone to decay and cavities.
Great. Didn't realize it was even that bad. I just had a sense that it wasn't good, and now we know. So this is kind of a political issue, isn't it?
It is a big political issue, because the concept is that for big industry to actually dump their fluoride waste from pesticides and so forth, it would cost them thousands of dollars. So what better way to offset your waste product than to sell it as this is a medication? Mm-hmm. There's also an ethical issue that we're mass medicating populations without their given consent.
Yeah. So do you take a position with your business? I mean, you're saying these things very publicly, and you're telling your clients. So I guess you're positioning yourself politically as to how you stand on these issues.
That's correct. I mean, I'm not a political person per se, but for me, this is a health issue.
Right.
And the public have been, in my opinion, misled as to the benefits of fluoride. It's like them saying cigarettes were good for you, that they helped you relax.
Right.
You know, it's a ploy. And when you say to people, actually have a look, it creates a lot of arguments. Mm-hmm. You know, and that's always going to happen. But for me, it's, if you want fluoride, use a fluoridated toothpaste. Go and get some fluoride drops, go and get a fluoride rinse. But please don't make sure everybody's having to have it. Yeah.
And it's actually quite difficult to find fluoride-free toothpaste.
Yes, it's a big search, and
because I'm on the lookout for it all the time. It's hard to find,
and to find one that actually tastes nice and feels nice in your mouth as well. A fluoride toothpaste has about 1,000 to 1,500 parts per million fluoride. Now, in the water, we're only allowed to put 1 part per million. Now, the idea is you're brushing it around your mouth and you're going to wash it out, and you're not actually going to swallow it. But your mouth's got loads of tiny little blood vessels in. So you're actually absorbing fluoride while you're brushing your teeth for 2-3 minutes, twice a day, every day.
So worth trying to search out the fluoride-free
Absolutely.
Toothpaste.
And look, we see families where they've grown up and they've never used fluoride. They've lived in unfluoridated areas. And there's going to be a range of decay rates in those families. And it comes back to nutritional status. Mm-hmm. What they're eating, how they're living, how they're taking care of themselves and their mouth. You know, someone who eats a very mineral-rich diet with lots of good fats and they're getting their vitamin D, they're going to have less cavities than someone who's drinking Coca-Cola and living on processed food. It's a no-brainer.
Mm-hmm. Okay. Well, something a little less controversial, cleaning our teeth, which is something we all pretty much accept is a good thing to do.
It's a good part of overall hygiene. Yeah, I totally agree.
Friendly approach to your partner and those you have to be in communication with. Now, I noticed that you've even been giving some recommendations on how people clean their teeth, kind of fun ways. Like I saw somewhere where you were suggesting to hold the toothbrush like a pencil.
Correct. What we see a lot these days is people have had the message of, I've got to brush my teeth and I've got to keep them clean, really drummed into them from a young age. And it's done almost from a fear base. So you're told, brush your teeth or you're going to get a cavity, brush your teeth or you'll have to go to the dentist, etc., etc. And people brush too hard, and they're actually wearing their enamel away, and they're making their gums recede, which is something you can't reverse. So you see these people with great big grooves in their teeth, very, very sensitive teeth as well, just from scrubbing their teeth too much. So one of the things I've been playing with is if you actually hold your toothbrush like a pencil, you can't press as hard. You've got to learn a new technique and get the manual dexterity back again, but you really can't press as hard. And in that, we'd always recommend a very soft toothbrush.
Right. And I've tried brushing my teeth with my non-dominant hand, so I'm
That's
right
always
hand.
good fun. You end up with toothpaste all over your face.
That's right. Now, also, I saw your bamboo toothbrushes, and I'm looking forward to trying those. Thanks for bringing me some today.
You're more than welcome.
And why have you invested in bamboo toothbrushes?
Well, think about it. Everybody is supposed to change a toothbrush about every 3 months.
Okay.
That's a lot of plastics going into landfill. It's a lot of plastics being generated as well. One of the things I was looking at with our practice this year is not only are we caring for people, but we want to care for the environment that we're working in. And we're putting a lot of green initiatives into place. And one of those things was looking for a totally biodegradable toothbrush. Now, we'd looked at some plastic ones that are supposed to compost down, but they have to go off to special centres, which we don't have here in Australia. And the bamboo ones that I've found are perfect because even the bristles decompose. And they're a lovely product.
Oh, excellent. Still to be changed every 3 months.
Absolutely.
Okay.
Because you can actually get sick from your own toothbrush because it harbours a lot of germs.
Of course it would. And what do you think about the idea of cleaning your teeth with baking soda?
Now, baking soda is another controversial area in dentistry. Some baking sodas can be quite abrasive. So again, if you've got a very heavy-handed scrubbing technique and you're using baking soda every day, it can be like taking sandpaper to your tooth enamel. I think with the baking soda, once in a while is the way to go.
Okay. And any other tips? Is it a good idea to brush your tongue?
Yes, absolutely. I think it's something like 60% of the bacteria in your mouth don't actually live on your teeth, actually on your tongue and your soft tissues. Your tongue's actually helping your body detox. Sometimes you can look at your tongue and it's very white. That shows there's a lot of toxins coming up out of the body. So by brushing the tongue, you're not only clearing bacteria, but that toxic buildup that's on the surface as well.
Okay, so you can't hurt your tongue by brushing it.
No, I don't think so.
All right. Well, speaking of soft tissue in the mouth, I see that gum disease has been nominated as your topic recently.
Yes, it's been pretty big.
You have a lot of people coming in with gum disease.
I'm seeing a lot of new patients at the moment with very chronic, severe gum issues that they're not even aware of. And they're at that point where 2-3 years down the track, if this is left untreated, they're actually going to have serious dental issues with loose teeth and abscesses and so forth.
Now, how can you not be aware that you have gum disease? It's not painful?
That's correct, and that's the ironic thing. If gum disease was painful, there would be queues outside every dental office every morning, people going, oh my gosh, my gums are sore. But it's a slow process that doesn't create pain in the initial stages. Now, the big thing with gum disease is not only is it harmful to your mouth, but it means that there's inflammation and bacteria and toxins from your gums going around your bloodstream, which is increasing inflammation in your body. And gum disease has been in the press a lot recently, where they're showing links to heart disease, diabetes, stroke, Alzheimer's, cancers, infertility problems, erectile dysfunction, and the list goes on and on and on. So getting your oral health under control is actually really beneficial for the rest of your body.
Well, what do you do? Like if somebody comes in the early stages of gum disease, is there a treatment plan? Or, I mean, can you
Absolutely.
regress it?
Early stage gum disease is very treatable, but you have to look at the whole person. If I just say to someone with gum issues, go away and brush and floss, yes, that's going to help. But often they'll come back and they say, I've been brushing and flossing more, yet their gums are still showing signs of ill health. And this is where we look at lifestyle, stress levels, sleep levels, and diet, and also whether they've got any underlying health conditions. Now, it's someone who's got high blood sugars but maybe isn't diabetic yet, that will cause stress on their system and make their gums more prone to bleeding. Same with someone who's anemic or low in B vitamins, for example.
Okay, so would it be fair to say gum disease is a symptom of other health problems?
Absolutely. For me, gum disease is a sign that there's systemic illness.
Okay.
And tooth decay is no different.
And I guess if you go for an annual dental checkup, your dentist would be able to spot if you have gum disease? Correct,
but there's things you can spot for yourself at home. If your gums bleed, you have gum disease.
You've got a problem.
Yeah,
okay.
You need to speak to your dentist. It's not normal for your gums to bleed.
All right. And that's the first sign that people
Absolutely.
should look
Or
for.
If your gums look red or swollen, or if they're sore.
Okay. All right. Well, another controversial subject, root canals.
Very big controversial subject, particularly in the field of holistic dentistry.
Because what might someone find themselves needing to make a decision about? What's the choices? Have a root canal or get it filled or get it pulled? What's the options
essentially, by the time your tooth needs to have root canal treatment, it's already in a very poor state. It's either had a lot of decay or some trauma, which has killed off the nerve and the blood supply inside the tooth. The tooth then becomes infected. So the choice we have as a dental practitioner is to remove that infection. Now, in the past, that used to be straightforward extraction. The tooth would come out, infection's gone. Now, dentistry decided that it could keep something dead in our body via doing root canal treatment. So that means we go in and we clean out the inside of the tooth. Now, I was trained you can sterilise that tooth, fill it up, all done, don't worry about it, tooth's fine. But there's a lot of research and studies that have shown that you can't actually sterilise a tooth. There are usually 3 main root canals, but there's miles and miles of little tubes that come off those. If you laid them end to end, there'd be about 3 to 4 miles of these little tubules, which all harbour bacteria. So the controversy is, are we actually keeping something that's toxic to your health in your body? Now, some holistic dentists would say straight off, never have a root canal, you should get them all taken out. For me, there isn't enough evidence to say yes or no. I think it should always be based on the individual tooth and the individual person, what their wants and wishes are and what their health is already like. And maybe look at using materials that are a little bit more friendly towards the body.
So could you give us a definition between traditional dentist, holistic dentist, or is there a reference to an alternative dentist?
Look, I think alternative dentists would come under that holistic dentist umbrella.
Okay.
I mean, under holistic, you'd also have biological dentist or biocompatible dentist. It's just different words for the same thing.
So could you give us just sort of how we can see them as 2 separate things?
Absolutely.
A traditional dentist and a holistic dentist.
Some traditional dentists would actually be working quite holistically, yet they don't label themselves that. Maybe they don't see themselves that way. A holistic dentist, it's more about our philosophy and our approach to treatment. We encapsulate a whole body approach. So we're not just looking at a tooth on its own, we're looking at that tooth and what's going on in the person. The other thing that would be different is we don't use amalgam because of the mercury issue. We don't advocate fluoride, as we've discussed. And we'd also look at using techniques that are more in line with working with that patient's body. For me, it's also about empowering that patient to take better care of themselves and to take responsibility for their own health and well-being.
Right.
Rather than just coming in and going, I've got another hole, it's your fault, you fix it, kind of attitude, which you do tend to see.
Yes. Okay, great. Thanks for that.
No problem.
Let's also talk about being a business owner, because you've gone into practice on your own. How long have you been in practice?
I've had my own practice now for 7.5 years.
Okay, well, I'm kind of amazed at how much you fit into a day.
Me too.
Obviously, you're early to bed and early to rise.
Very much so.
Did I see that you recently, like a year ago or something,
moved to a new clinic or built a new
clinic?
We built a new clinic just over 2.5 years ago.
Okay.
So most dentists, when they start a practice, they go and buy one from somebody else.
Right.
So it's already set up and established and they've got a patient base. No, that wasn't how I was going to do it. I had this kind of field of dreams thing where it was build it, they will come.
Okay.
And I didn't like commuting, and I found premises within 2 minutes of my home.
Excellent.
And we did a complete fit out, got everything ready, borrowed the money and opened. And yes, they came. And 5 years on, we were in a position where we could move premises, but I'd already put wheels into motion for that. I didn't want to pay massive commercial rents because it just seemed like dead money to me. And we'd had a landlord that was really uncaring about the property, and I didn't want to go through all that, gee, something needs fixing, we have to fight them all the time to get them in. So I actually bought a house in Kenmore with the proviso that council might give us permission to change it into a dental practice.
Okay.
So we went through that process, which took about 18 months, and then pulled all the living daylights out of this beautiful house, reconfigured her, and made a dental practice.
Okay. And this is the one in which you live very nearby?
That's correct.
Right.
Yeah.
Excellent. Now, back to your reference about becoming more green in your business. What else have you done besides the lovely bamboo toothbrushes?
So we have solar power for our hot water. Mm-hmm. We have 2 very big rainwater tanks to capture all our water supply, which we then use for flushing toilets and washing machines. We separate our clinical waste from our non-clinical waste, mm-hmm. and then we recycle what we can. Obviously, our clinical waste has to go for incineration. That's the rules. We also used a flooring material that's like a vinyl, but it's actually made from linseed, and it's going to last for about 20 years before it has to be pulled up and replaced. So there's just little things that we're putting in. We're working with the Eco Dentistry Association in the US at the moment, and they're going to help us go through some guidelines where we can really take this green concept to another level. I mean, we've got low voltage bulbs and LED and all mm-hmm. those sort of things, but there's a lot more we can do. We're a small dental practice, and we create 3 bags of waste rubbish every day. Yes, wow. It's a lot, and a lot of that is plastics.
Mm-hmm. All the gloves you have to wear.
Yeah, and all the gloves and
masks.
Patient bibs and things like that.
Right. Well, you strike me as someone who, although quite easygoing, has a very specific standard of things that your business must have to measure up to. So would you say that's true?
That is true. I am very particular when it comes to work.
All right. So how do you go about finding staff that fit in your business ethics and are available for the hours that you want?
This has been, I would say, probably one of the biggest challenges of the business. I was very lucky initially to have a lady who I'd worked with before who came along and helped me out and did my practice manager's role for 5 years. And I was also very lucky to have a dental nurse for 4 years as well. Mm-hmm. But it was interesting once we moved, and we'd moved into a premises that was my energy, mm-hmm. that they couldn't step up to the plate with that in some way, and it was very apparent it was time for them to take their own journeys in life. And we've now had the last 12 months or so where we've had a lot of changeover of staff. Mm-hmm. And it's not that I'm like, it's got to be a certain person, but it's finding that gel within the team where everything comes together, everyone takes responsibility, and that the ethos of the practice, which is to truly care for people, comes through. And what we've found this year is that those who are really good at the job live miles away, uh-huh. and they find the travelling very difficult.
Especially in city traffic.
Yeah. Or those that think they can do the job actually don't have the ability or the skills, and unfortunately they just don't cut what our practice is looking for. Mm-hmm. But it is very challenging trying to find staff, and I think anyone who owns a business has that fun and games. Right. And you learn a lot about yourself in that process, because it's like having family.
Except you get to interview this lot.
Yes.
Yeah. So do you enjoy this aspect of your working life, being the business owner?
It's something I've really had to learn. I would say a lot of it I've made up as I've gone along, and there's been trial and error, and I've made mistakes, as we all do. Mm-hmm. But from those mistakes you learn. Do I necessarily enjoy it? I hate admin, but it's part of the job. It has to be done, and I'm learning to love it more. I have a very supportive partner who actually comes in and helps a lot with the business. Otherwise, I don't think I'd be able to manage.
Right. Good on you, Sandy.
Yeah.
Well, let's talk about that internet presence that I've alluded to a couple of times. Now, you've got this website that's also fairly new or renovated recently, is it? Or is it the same website?
The work one?
evolvedental.com.
That was renovated about 2 years ago, not long after we moved, and we're in the process of doing another revamp to bring it a little bit more up to date and to make it mobile friendly, because apparently most people now don't use their computers to search. They're on their mobile phones, and if the print comes up really small, they're not going to look at your page. But we're also trying to make it look a little bit fresher and just
something
more user friendly.
Absolutely,
and it's a lot of fun.
Yeah. Now, do you feel like you invest a fair bit of time and energy in your website?
Oh, absolutely.
Yeah. And are you doing that mainly for your existing clients or to attract new clients?
It's a bit of both. One of the big things that I'm very passionate about with dentistry is education and allowing people to understand what's going on. It blows me away how many people have no concept of what they've had done in their mouth, why it's happened and what's gone on. So I invest a lot of time in explaining who we are, what we do, a lot about holistic dentistry, but also I produce blogs where I probably write one a week and pop those out as an informational for patients, and that does bring new clients, but it also reminds our old clients, hey, this is why you come to us.
Right. Have you done any research to find out if the web actually brings new clients in?
Yes, we've set up a thing called Google Analytics. My wonderful web team, thanks Rebecca, did all that for me, and I can just go on and it'll show me how many hits we get every month, which pages are popular, and how many people are actually staying on the site and looking at other pages, and how many people are popping back out. So one of the things we've realised is that our homepage has words that the normal person on the street probably doesn't understand the concept of. So we're now working on changing the copy on that and making it more about this is why you should come and have a look at a holistic dentist. Okay,
well, I look forward to that. So I'll give the listeners just a moment to get their pencils and paper, because we've got a few links to give them in this next part. This will be other ways you can get to know more about Rachel's life as a dentist and as a blogger, or as a cook, or as a student of life, which
Correct.
is probably your second website I'd like to talk about, which is drrachelhall.wordpress.com. That's all lowercase, one word. The byline on that is Musings from a Student of Life. Now, why did you decide to start this blog site? Because as I said, there's plenty of other places for you to blog on other people's, but you needed a space of your own.
Well, I feel that people see me just as a dentist, and you get boxed into that category, and you go out and people say, what do you do for a living? Oh, I'm a dentist. And they start talking to you about their wisdom teeth.
Yeah.
And I've always said, dentistry isn't who I am. It's my job. It's how I express me. And I just wanted an avenue where I can say, hey, there's more to me than that. I actually think about things. I actually philosophize. I actually observe life, and I notice things. And it's just a place to say, hey, guys, this is going on in society. This upsets me. Or, oh, wow, this really touched my heart. And to share that with people. If people want to read it, that's great. And if they don't, I enjoyed writing it.
Well, and I enjoy reading it. And some of the fun in it for me is that sometimes your blogs are incredibly short. I have a recollection that one day you put out a one-sentence blog. I'm not sure.
Probably, yes. Or maybe that should have been a Facebook post.
Or there's 4-sentence blogs there that I think beautiful, because you really don't need to, you've captured it all in those 4 sentences. So it's fun to see these very short blogs.
And personally, when I'm reading somebody else's work, I find it very hard to read if it goes on and on and on. Mm-hmm. And sometimes you go, you've actually made your point.
Yes.
You don't need to expand any further.
To go on. Well, I was reading a blog the other day, Lady Overwhelm. Have you ever read
Yes,
that
I
one?
have been on there when I've had a spare 30 seconds here and
I
there.
don't know where you would have that. But anyway, her blog the other day was actually about dentists.
Oh, okay. I should check that out.
Yeah, and what she wrote about is that dentists, or at least her dentist, is recommending that you should brush your teeth for 2 minutes at a setting. And so her dilemma was how to quit multitasking while she was spending 2 minutes brushing her teeth. And she found in the end that she engaged with herself in the mirror for a full 2 minutes, and how revealing that really was. So 2 questions. Should we brush our teeth for 2 minutes?
That's the prescribed amount of time. The reason being is plaque's very sticky.
Uh-huh.
And if you don't brush it for long enough, it just doesn't come off the teeth. Also, while you're brushing, you need to be massaging your gums.
Okay, right. And the other question I think you've answered, which is, do you read other people's blogs? Do you have time?
I do. I sort of skim read. I'm very good at picking out little bits of information, and then if I find that it's something that I'm enjoying, I'll actually just save it and read it later when I've got more time.
Uh-huh. Good. Because you do also contribute on Facebook.
Yes, I've been very proactive on Facebook. It was something I'd always resisted. My concept of Facebook was that it was just very trite and not somewhere I really wanted to contribute. And I'd had this feeling that I wasn't speaking to enough people in my daily life, and that to reach more people, how we were going to do that. And essentially, humanity is on Facebook. So if we want to speak to people, that's where we need to go. And so I set up my own profile. So that's just me having a chat with my friends and sharing bits and pieces. And then I also have a Facebook page for the dental practice where I put up a lot of the latest news and research just about dentistry and health and well-being.
I think 1 in 8 people on the planet have a Facebook account.
It's quite surprising, isn't it? Mm. And the growing demographic is women over 50.
Oh, right. And you also are on Twitter?
Yes, I got into Twitter about October last year. Took me a little while to sort of get used to the concept. Very different to Facebook. Mm-hmm. It's very just what's there now. It's like you can't sort of look back very easily at who said what. But what's been quite fascinating is that I've set up a network already with some great dentists and dental practitioners in the US, and we're sharing information between each other and learning from one another about practice management and running businesses and just the world of dentistry, and it's really quite a lot of fun.
Oh, great. And you do LinkedIn?
Yeah, LinkedIn was one of those things, again, where I really don't understand what this is about, but the more you use them, the more you see that they have a benefit. And LinkedIn is very much about getting a business profile and a presence on the internet, so that if someone's Google searching me, for example, they've got more that they can look at rather than just my website.
Uh-huh. Now, I also noticed that you're blogging on a few other people's websites. The healyourselfwithfood.wordpress.com. Does that belong to a certain person?
That belongs to Sarah Cloutier, who lives in the UK. She's Australian by birth.
Okay.
She also writes for Huffington Post in the UK.
Yeah, right.
She's set up a community on Facebook that's essentially a place to share gluten-free, dairy-free, sugar-free recipes. And we've all just been contributing to that. And then from there, Sarah started the blog, and things that we contribute also get shared on there. So it's a really great resource for people who are looking for a different way to eat and care for their body.
Okay, so listeners, that's healyourselfwithfood.wordpress.com. Again, all lowercase, one word. And I guess it's, at first I thought, oh, and she's a cook too, and contributing recipes. But then when I kind of followed that through, I thought, well, it's just part of your love of health and nutrition.
That's correct. And when I changed my way of eating for health, it was very difficult to know, well, what am I going to eat now? So I'd given up gluten and dairy quite a long time ago, but was still a very big carbohydrate monster. It was what I needed to get through the day, and it was actually making me ill. About 5 years ago, I'd gained 10 kilos. My blood sugars were starting to go high end of normal, and my thyroid was dropping. So I saw a great GP who just said, Rachel, come off the carbohydrates. Let's up your protein levels. Let's get some better nutrition going on here, and we'll see what happens. And I said to him, well, what am I going to eat? I already have restricted diet anyway. And he says, just got to be more imaginative. So from there, it was searching the internet for recipes and ideas, and then sharing that with, saying to friends, well, what do you eat? What do you have? And sharing that. So there's definitely a great need for that within the community.
Do you have a quick recipe off the top of your head?
Yeah,
that you would
off
share?
the top of my head. One of the simple things I really like to do, because you can prepare a lot of this in advance, is just a really nice warm chicken salad. So what we do is I cube up a pumpkin, so about half of a butternut squash, I think you call them, that's the word. So cube up that, a head of garlic, and you roast that in the oven. And then I just pan fry little chicken pieces, and then I toss that through rocket with some chili, lemon juice and olive oil and a few toasted pine nuts. Mm-hmm. Really, really lovely meal.
Sounds excellent. And now another site that you contribute to is called Ezine Articles. So that's EZINE articles.com, all lowercase. How did you get onto that, and what kind of articles are on that site? So
ezine.com is a way that you can share your expertise with the world.
Okay.
And I'd seen it mentioned in places, and I'd looked at it and I'm like, oh, there's some good information on there. What I didn't realise is that you can actually sign up and write your own articles, and I've started doing that only about a month ago, maybe even less than that. And basically I've been taking my information that I've got on my website and just tweaking that and submitting those articles for publishing. And I think I've had 19 articles published so far. And so most of those are about dental health and well-being. I also had one put in self-improvement about stress, so that was pretty exciting. Mm-hmm. But
well, the article that caught my eye when I was searching you there on that site, Ezine Articles, was 10 tips to boost your immune system. So I thought, could you just share a couple of those tips? Do you remember what they were?
I think I remember some of them. Basically, to keep your immune system healthy and strong, you've got to take care of your body. And our body needs rest, it needs sleep, and we mean quality sleep. So for me, quality sleep is about going to bed already relaxed and calm, rather than looking at the clock and going, oh my God, that's the time I've got to go to bed. It's also about reducing our stress levels, make sure we're well hydrated, that we're eating well, and that we're exercising. But by exercise, I don't mean punishing yourself, pounding the pavements or pushing hard at the gym. That is actually harmful to your immune system. By exercise, I mean just keeping active, going for a walk, having a swim, standing up more often.
Great. Easy tips. Something
very easy, very practical.
Yeah. Now, I'm aware that last year sometime, you got caught in a negative media attack. And I'm just wondering, because I understand from who you are that you would have been speaking about many of the things that we've spoken about today. It must have been kind of a shock to you to see that interview turn into something totally different than that.
It was very shocking. I would be a liar if I didn't say I was quite upset and hurt by the process. I'm sure you can hear that in my voice right now. I gave an interview for about an hour or so where we talked about dentistry, well-being, lifestyle, healing, religion reincarnation, my love of Da Vinci. A lot of things were discussed, but in my naivety that I was expressing my truth and that maybe that would get reported, I didn't stop and go, hang on, what's the agenda here? Mm-hmm. But it was pretty obvious once it went to press that the media had already got their story written, and all they wanted was a line or something that they could use. Now, the interesting thing with that is they couldn't actually take anything I said and use it against me. What they actually printed was good common sense. So what they did instead was try and label me as something that I'm actually not.
Uh-huh. Well, I'm sure that was a very difficult time for you. And I'm wondering if that's contributed to your interest and the energy that you have been in recent months then putting into your internet presence.
Look, there's a twofold thing there. One of that is to say, hey, I have my own voice, look at my stuff, see who I am, and then you decide for yourself whether what was in the paper was true or not. And the other is to say, well, if you're going to Google search me, I want you to be looking at my things and not some defamatory stuff that's been written in the paper.
Mm-hmm. Right.
But it's almost like they unleashed something in me. My feeling was what the press wanted to do was shut me up, because I'd already been sharing a lot of my information on Facebook and so forth. Mm-hmm. But it's had the opposite effect. It's kind of woken me up to say, no, I have a voice. There's stuff that I need to say.
Mm-hmm. Well, and we have so many platforms today that we can use to share information.
That's
and to
right.
share ourselves.
And with the internet, you can almost become your own media.
Right. And which you are, in effect, doing. You're talking about doing podcasts.
Yeah, I think that should be a lot of fun.
And it's something that would be on your website. Is that how we would know?
Yeah, that's probably where it would go initially, is on the website. Maybe on iTunes at some point. Who knows?
Mm-hmm. Well, I appreciate you coming in for the interview today, and it'll go up in full so that the listeners can hear your voice.
Thank you.
But let's close with a couple of tips on how to whiten your teeth.
Okay.
Now, I saw that was one of your blogs.
You have been doing your research, haven't you?
Well, I used to be on the internet more than I am at the moment, and I was kind of curious how you just were popping up here and there, and I do enjoy your Dr. Rachel Hall blog site.
Thank you, Gayle.
Musings on the Student of Life. That's very precious little writings. But some tips on how to whiten your teeth. Now, how does lipstick come into this?
Look, I'll do a little disclaimer here, ladies and gentlemen. I never wear makeup, so this is a bit of a funny one. But apparently the shade of lipstick that you choose will either make your teeth look whiter or yellower. Okay. So I think stay away from the coral pink colours and go for more reds.
All right. I just couldn't quite figure that one out because obviously I don't wear lipstick either. Baking soda we covered. Now, peroxide?
Yep. A very dilute solution of hydrogen peroxide, so about 3%. You can actually mix that with your baking powder, and you can then use that as a mouth scrub, but obviously not every day. Or you can actually use it as a mouthwash. And what I do is I get the hydrogen peroxide and I'll put a few drops of like tea tree oil or peppermint oil or some clove in it, brush my teeth and then fizz it around my mouth for a minute or two afterwards.
Okay.
So that actually breaks down staining that builds up on your teeth.
Uh-huh. Is that something you could like pre-mix a little supply of?
Yeah.
Or do you mix it each day?
Yeah, I mean, with the hydrogen peroxide, you could just open the cap and put your essential oils in.
Okay, great. And olive oil?
Yeah, olive oil and coconut oil apparently are quite antibacterial. And something I've been reading about that I'm not 100% certain on is an old technique called oil pulling, where you actually just put a teaspoon of olive oil or coconut oil into your mouth and you just keep swooshing it around for about 15 minutes and then spit it out. So what that does is it actually helps draw toxins out of the gum tissues. And apparently it whitens your teeth while it's doing it.
That sounds great. Okay. And strawberries? Nuts?
Yeah. Nuts is because of the mineral content. Mm-hmm. So if you've got porous teeth, low in minerals, they're going to discolour more quickly. And strawberries, I think it's because of the acidity and the pippiness that just helps to lift the colour.
Right. Well, thank you. So much
My
excellent
pleasure.
information. Anything else you'd like to leave the listeners with today?
Just to be really kind and gentle with their bodies.
Lovely. Thank you for coming into Fiery Service today, Rachel. You've been listening to an interview with Dr. Rachel Hall. Her dental practice is in Brisbane, and her website is evolvedental.com.au. I'm Gayle Cue. Thanks for joining us.